Welcome to the Explainer. Pain is something we all experience, but how we manage it, well, that's a pretty complex science. Today, we're going to unlock the medicine cabinet and really break down the science behind analgesics, the medications we count on for everything from a headache to post-surgery pain. Okay, let's dive right in. To get how pain relief actually works, we first have to understand pain itself. So, what is pain? And is it all the same? Spoiler alert, it is definitely not a one-size-fits-all kind of thing. Our body has different ways of sounding the alarm. So, here's what we're going to cover in this explainer. We'll start with the body's alarm system itself, then climb the ladder of pain management, from the basics to the most powerful options. And finally, we'll look at how we can use them safely. All right, first up, the science of ouch. Let's get into the fundamentals here. What is pain really? And how does your body even signal that something's wrong? It all kicks off in the nervous system. Okay, so this is a really key distinction right here. You've got acute pain. Think of it like your body's specific alarm system for an injury, right? A cut, a sprain. It's sharp, it's immediate, and it tells you something's wrong. But chronic pain, that is a whole different ballgame. It's like a faulty alarm that just won't shut off, sometimes ringing for months on end, and often without a clear reason why it's still going. So how do we shut off that alarm? Well, that brings us to something called the gate control theory. Imagine the nerve pathways to your brain have these, gates. When you get hurt, those gates swing wide open, letting that ouch signal rush through. Pain meds, or analgesics, are basically the gatekeepers. Their job is to slam those gates shut, or at least close them partway, to turn down the volume on the pain we feel. Okay, let's start with the first line of defense. We're talking about the most common pain relievers, the ones you can find in pretty much any medicine cabinet. Yep, these are the ones we all reach for those everyday aches and pains. We call them non-opioids, and a lot of them fall into a category you've probably heard of, NSAIDs, which stands for non-steroidal anti-inflammatory drugs. The cool thing about them is they work right where the injury is. They basically stop the production of the chemicals that are screaming, "This hurts," to your nerves. The story of aspirin is just amazing. It started out over 100 years ago as a simple pain and fever reducer. But then, as science got better, we figured out it does something else really powerful. It stops blood cells' platelets from sticking together. And that little side effect, it turned out to be a massive game changer, making aspirin a key medicine for preventing heart attacks and strokes today. Now, this is incredibly important, a huge safety warning from health authorities everywhere. While aspirin is a wonder drug for adults, you absolutely should not give it to kids or teenagers who have a fever or a virus. Why? Because it can lead to something called Ray's syndrome, which is rare, but it's a super serious condition that causes swelling in the liver and brain. Okay, here's something that trips a lot of people up: acetaminophen. You probably noticed Tylenol sits right next to aspirin and ibuprofen on the shelf, right? But it's actually in a different league. It's great for pain, it's great for fever, but it doesn't fight inflammation. And for that reason, it's not considered an NSAID. Now, for acetaminophen to do its job safely and effectively, the amount of it in your blood has to stay in this very specific range. Think of it as the safety zone or the sweet spot, where it's giving you relief without causing harm. But if you go above that sweet spot, that's when you hit the danger zone. A serum level over 200 is considered toxic, and it can lead to some really serious liver damage or hepatotoxicity. This is exactly why it is so critical to read the label and never, ever go over the maximum daily dose, which for most adults is 4 grams. All right, so now we're going to climb a little higher up that pain ladder. Let's talk about the heavy hitters, the medications that are brought in for more intense pain. And they work in a completely different way. So remember how non-opioids work right at the injury site? Well, opioids are different. They go straight to the command center, your brain. They act like a specific key fitting into special locks in your brain called receptors. When they bind to these receptors, the main ones are called mu and kappa, they don't just block the pain signal, they actually change how you perceive the pain. The catch is, those same receptors also control really important stuff like your breathing. Okay, so we've met the two main teams. Now let's put them head to head. Understanding how they're different is really the key to modern pain management. This chart really lays out the fundamental trade-off, doesn't it? On one hand, you have non-opioids, like aspirin. They work out on the periphery, at the source of the pain, and their biggest risk is usually something like stomach irritation. On the other hand, you have opioids, like morphine. They offer powerful central relief right from the brain, but
they come with that much more serious risk of slowing down or even stopping your breathing. It's a huge difference.
And this is one of the biggest risks when using opioids for a long time. Your body literally gets used to having the drug around. It adapts. So if you suddenly stop taking it, your nervous system kind of freaks out. And that's what causes the really awful symptoms of withdrawal. And listen, this right here could literally save a life. Opioids already slow down your central nervous system. If you mix them with other things that do the same thing, like alcohol or certain anxiety meds, you're not just adding the effects, you're multiplying them. And that dramatically increases the risk of your breathing slowing down to a dangerously low level.
All right, for our last section, let's look at how healthcare professionals use these incredibly powerful tools. How do they give patients relief while keeping them safe?
A perfect example of this is a PCA pump. PCA stands for patient-controlled analgesia. It's a smart pump that actually lets the patient give themselves a dose of pain medicine when they feel they need it. But, and this is the important part, it's not a free-for-all. The pump is programmed with really strict safety limits, a lockout mechanism so you can't overdose, and all the while the nurse is keeping a close eye on vital signs, especially breathing, to make sure everything's okay. You know, using these meds safely isn't just for the hospital. What you do at home is just as important. And that means simple things like keeping all medicines locked away from kids, especially the flavored ones that can look like candy. It means double-checking the labels on over-the-counter stuff so you don't accidentally take too much. And it definitely means knowing the red flags like feeling super dizzy or having trouble breathing and knowing when to get help right away. These are simple but absolutely vital steps. And for some people, physical dependence can turn into a substance use disorder. When that happens, it's really important to know that there are resources out there to help. Methadone treatment programs are a key one. Now, methadone is also an opioid, but it's used in a very controlled medical setting. It helps prevent those awful withdrawal symptoms and reduces cravings, giving someone the stability they need to start on the path to recovery. So when you think about it, from a simple aspirin for a headache to a sophisticated PCA pump after surgery, the way we relieve pain is, well, it's a medical marvel. But it's also a huge responsibility. Really understanding the difference between these drugs, knowing their risks, and using them safely, that's the most important first step for everyone involved.